Hi everyone, I'm really glad that you're here. It's getting so close to International Women's Day, and I thought what better time to have a little chat about one of my favorite subjects, which is the gender health gap that women experience. And it is unfortunately something that probably every single woman experiences, whether she realizes it or not. I don't want it to be a conversation about, fear or frustration, although this topic can be super frustrating because as you become more aware, and I'm going to share some insane statistics with you, it really does kind of get you pretty fired up. But for me, I want it to be more about empowerment, because once we're more aware, that's when we can do something about it. And I think more and more women, especially the next generation behind us as well, needs to know about it so that we can try and help make it better. And advocacy, right? It starts with awareness. So just being here to talk about this subject is a really great first step. So there's no wrong answer. I'm going to ask a question. Please jump in and type a number if you feel up for it. But I have a question, and again, just take a guess. In the entire history of we'll go with U.S. clinical research, so medical research, which goes all the way back actually to 1747. 1747 to today, how many years do you think that women were actually required to be included in that clinical research? Any guesses? Okay, I will tell you. It is 32 years. Out of all those hundreds of years, it's 32 years that women have been required to be included in medical research. And it actually wasn't until June 10th, 1993. So I don't know how many of you are watching that John F. Kennedy Jr., Carolyn Bessette Kennedy docuseries Love Story. They got married in 1996. That was not that long ago. And this legislation came into play in June of 1993. So I was in my last year of high school. That just feels like it wasn't that long ago, even though I guess it was. But that's when women were required to be included in medical research. So we're talking things like cancer, heart disease, Alzheimer's, diabetes, vaccines, prescription drugs, mental health, all of it, literally everything. And so when we talk about the gender health gap, that's where it begins, with decades and decades and centuries of missing data. And, it wasn't just that we were forgotten. This is the message I want to send. We were actively excluded. And so what happened is in 1977, the FDA made a recommendation that women of childbearing potential should be excluded from drug trials. Just not included. And this was partly a reaction to the thalidomide tragedy in the 1950s, where a drug that women were given for morning sickness had caused severe birth defects, even though that drug was actually never even approved or indicated for morning sickness. So that fear from that situation stayed. And then what they layered in on top of that for excluding us legally, or saying FDA saying no women in trials, was that they deemed us as too complicated to study. We're too complicated to study. Our hormones make things messy. It's unpredictable, and it's just too expensive to study women. So instead of including us in these clinical studies, they simply studied men and made the assumption that all of it would translate, right? Because we're just exactly the same. So obviously our bodies aren't interchangeable, but the theory was we're just like little men. And so this deficit in research that existed all this time is what manifests as now the gender health gap, right? This massive blind spot in medical science that still affects us today. And in fact, after women were now included, so after 1993, when they legally said we had to be included, between the years of 1997 and 2001, the FDA actually pulled 10 drugs off the market. 8 of the 10 were found to pose significantly greater health risks to women. Why? Because they didn't study the drugs on women in the first place, right? So they didn't know. It's so frustrating, I know. But when you're prescribed a medicine, when you're told you need a procedure, when you're given a treatment, most likely this has only been studied on men, which is crazy, right? So, what does the actual gender gap look like when you're looking at it holistically? I'll give you some examples, some of the biggest examples, and everything I'm going to tell you, all of these statistics are backed by evidence, medical research, and studies and papers that have been written. So first we'll talk delayed diagnosis. They looked at 770 different diseases. Across the 770, women on average were diagnosed 4 years later than men for the exact same diseases. 4 years later. Look at pain. This one kills me. 70% of people living with chronic pain are women. 70%. But 80% of all pain studies were done on male mice or on women. Or on men, sorry. Male mice or men. So 70% of pain sufferers, chronic pain sufferers are women. 80% of the studies are done on men. Surgical outcomes. This is super disappointing, but women are 32% more likely to die if their surgeon is a man. 32% more likely to die if your surgeon is a man. Medication side effects. Women are twice as likely to experience adverse side effects from medications, not because our bodies are reacting strangely, but because the research didn't include us. Yes, women suffer silently. I totally agree. Research priorities. This is one of my favorites. So for every one study on PMS, which affects 90% of women, there are 5 studies on erectile dysfunction, which affects 19% of men. So our conditions that we all suffer from, those are just not research priorities, right? Cancer, women are diagnosed with cancer 2.5 years later than men. And then heart disease. This is a big one, right? Because this is heart disease is the number one leading cause of death for women. Women with heart symptoms are more likely to be told that they're stressed or anxious instead of actually receiving a full cardiac workup. And we're more than twice as likely to die after a heart attack than a man. Twice as likely. And as we said, heart disease is the leading cause of death in women, yet only 1/3 of clinical trial participants in all heart disease studies are women. 2 out of 3 are men. And finally, if you look at funding, because that's where this all comes down to, right? The research dollars have to go towards what women are struggling with. Ladies, we are 51% of the population, but only 1% of global healthcare research dollars and innovation is invested in female-specific conditions, excluding cancer. So if you take cancer out and look at everything else, 1%. We are half the population. It's insane to me that this is still where we are today. And that's from 2022, a giant paper that McKinsey did looking at that. So, when you look at like really specific conditions, if you start with, for example, menopause, because that can be so misunderstood, it is absolutely insane. Thank you, Carly. It blows my mind, right? I can lose sleep over it because it does get me frustrated, but I'm trying to just focus on empowerment. 51% of the population and 1% of the dollars go towards what we're struggling with. It just doesn't make sense. But if you think about menopause, so they looked at 500 postmenopausal women. 48% of them said, I have vaginal symptoms, things like dryness, things like pain, things like burning. And 80% of those women said it's really negatively impacting our lives. Yet, how often is that talked about, right? Talk about suffering in silence. Women are, how we're not given the solutions for this. Instead, we're being told it's just aging, you're postmenopausal, what did you expect, right? Yet menopause is just so much more than hot flashes. I know the last live I did, I was talking a lot about the genitourinary syndrome of menopause and how we focus on hot flashes. We're not focusing on all these other symptoms. When we ignore pelvic health and sexual symptoms of menopause, we're actually ignoring quality of life, right? Another big one that I get fired up about is endometriosis. It affects 1 out of 10 women. And before getting diagnosed, 58% of people with endo have visited their doctor over 10 times. 43% of them have been to the hospital more than 5 times, right? And for the diagnosis, like I said, on average, it's up to 10 years. And for women of color, it's even longer than that, which is just completely unacceptable to get a diagnosis. 3 out of 4 endo patients are misdiagnosed first, and mostly, guess what it's for? Mental health conditions, right? Like we're there complaining of chronic pain and we're told it's a mental health condition. So this is what happens when women's pain is not studied, when women's pain is not believed, when women's pain is ignored and not prioritized. And what does that cost the healthcare system? 10 visits to the doctor, 10 years of appointments, going to the hospital so many times, being misdiagnosed. It just needs some studies. It needs more investment. It needs to be a priority. And finally, when I look at an area like sexual health, I mean, literally, like, there's like no research. There's very little going towards women's sexual functioning, but erectile dysfunction, 30,000 studies, 30,000 clinical studies behind it. Yes, Carly, totally. People don't understand how deep the inequalities still are. That's why I'm doing this tonight, because I think sometimes you just have to hear it and understand and get fired up about it. Erectile dysfunction, like I said, 30,000 clinical studies behind it, more than any female-specific condition. And that is not because erectile dysfunction is more common. It's because it's been prioritized. It's because it's getting the funding, right, over our conditions that affect us. And we've normalized women having pain, like especially with sex, right? We've normalized women having pain with sex. We've normalized leaking when you laugh, cough, sneeze. We've normalized changes in desire, but none of these things are actually, normal. They are common. Women are struggling with them, but they are not just part of being a woman. They are conditions that deserve to be treated. But again, we just haven't had the research. And this is really why I founded UROSPOT, which is, how I want to make this connection is that, for me, I was really passionate about where can I make a difference in helping close this gender gap. And pelvic health is one of the most ignored, under-researched, misunderstood areas of women's health, despite affecting millions and millions of women across all ages. And over again, I've had the honor of listening to our clients across this country, and now in the UK, we just opened there as well. And what they tell me is the same story. I was told this was normal. I was told, what do you expect? You had children. I was told, what do you expect? You're in menopause. I was told, it's not bad enough to really do anything about it, so why don't you just live with it? Or women going into the doctor for pelvic organ prolapse. This one I'll never forget. And the woman was told, come back when it's getting caught in your zipper. That means an organ coming out of your body and getting caught in your pants zipper. Like, it's so unacceptable. And so I founded UROSPOT to try and close this part of the gender gap, or at least play a role in trying to help that, to give women evidence-based pelvic health care, to create a space where it's staffed with incredibly skilled, compassionate, interdisciplinary experts, and not experts in Botox, not experts in facials. That is not where you go for pelvic health. Experts in pelvic health who are there to offer hope, but also to offer real solutions and to not dismiss, right? It's the dismissals that I think we're all just so sick and tired of, and we need to get pretty fired up about that. So every day I find women walking through our doors who are telling us that they were told their symptoms are just part of being a woman, and every day at UROSPOT they're getting to discover it's not true, right? So advocacy really begins with awareness. And today I'm hoping that if you're listening to me, you just become a little bit more aware. But I also don't want it to just be Debbie Downer. I want to give you like a few, what can I actually do with this information? A few points like that. So I'll give you just a few, and that's where I'll end it for today. One is to share it, right? Share that with other women. Share that with the men in your life. 1% of research dollars are going to women's health. Women are 32% more likely to die if their surgeon is a man. Like, it's crazy, the statistics. So share it, because awareness spreads through conversation. And when you see it, you can't unsee it, right? So look for that gap and talk about it. I'll give you another example that just drives me crazy. I find it super insulting as a woman, is the advertising for adult pads and diapers for incontinence, trying to convince us as women that it's totally cool to wear these, and you'll feel super sexy because these ones are black or these ones have purple flowers on them. You can't see it, like you'll just feel amazing in these. No, we know what that is. It's a diaper. We're not idiots as women, right? And that's not how we want to live our lives, but we're being told that it is normal and that this is just what you do next. That's the stuff we have to get kind of questioning and talking about in conversation. The second one is to ask questions. The next time you are prescribed a medication, the next time you are prescribed a procedure or a device or a surgery, whatever that is, ask your provider, ask your healthcare professional, has this been tested on someone who looks like me? It's a simple question, but it forces transparency, it forces accountability, it forces them to go do some research as well, right? To go check those studies. Were women actually included? What were the side effects just for women versus men? You have the right to ask those questions. Has what you're about to give me been tested on someone who looks like me? Third, the next time you're told what you're experiencing is normal, pause and ask, is this actually common or is this normal? Because they are not the same thing, right? They are not the same thing. And yes, incontinence is common, not normal. I'm just reading the comment here, and it can be treated, and women deserve to be treated. It's one of the top reasons women end up in long-term care, and it's something that can absolutely be treated earlier in life. We shouldn't be accepting that we just live with this. And the fourth one is what I just kind of am saying, is to advocate for yourself. I mean, really put yourself first and don't allow yourself to be dismissed in our healthcare system. That happens too often, right? Like the what did you expect? Come back when it's getting caught in your zipper. No, I expect that my body is going to function the way it was designed to, and that you're going to help me find a solution for that that's been tested on someone who looks like me. So it's International Women. I know it's not today, it's this week, it's coming up, but I thought I'd get ahead of it and talk a bit about this gender health gap. It's a topic I really try and focus on in March, especially when we're getting a little bit more of the spotlight, because closing that gap really does start with us as well. We have to be the voice. We have to advocate for ourselves, for our bodies, and for each other. I hope you guys enjoyed this. I hope you got a little fired up. I hope you're going to share one of those statistics with somebody that you know. And check us out at UROSPOT.com if you want to learn more about what we do. Like I said, it's a safe, empowering environment where we educate women on all things pelvic health. You'll learn about your body and you'll leave super empowered. So happy almost International Women's Day from myself and the whole team at UROSPOT. Thanks for joining me.